Good afternoon from Washington. This is former Congressman Mike Ferguson. I'm the leader of BakerHostetler's federal policy team. And welcome to our bipartisan webinar series, BakerHostetler bringing Congress to you. Like a lot of activities across the country, Congress itself is closed. The buildings on Capitol Hill are closed to the public. Lawmakers have shuttered their offices. Congressional staff are working remotely from their homes. Now, Congress may be closed in the traditional sense, but the work of our government, as I'm sure you know, is continuing, sometimes at a breakneck pace, as Washington continues to respond to the coronavirus pandemic. That's why we here at BakerHostetler are delighted to begin this bipartisan webinar series. You'll get to hear firsthand from key lawmakers from both the House and the Senate, from both Republicans and Democrats. We'll take you inside the private caucus meetings, inside the negotiations in the cloakrooms. We'll take your questions on how the government is responding to the coronavirus pandemic and what Washington needs to do next. We'll be joined in just a few minutes by a leading healthcare voice on Capitol Hill and a member of the Senate Republican leadership, Senator Roy Blunt from Missouri. First, I want to introduce my partner in this bipartisan webinar series, my colleague at BakerHostetler. He's also a senior advisor here at the firm. He is a former Democratic congressman from North Carolina and forever number 21 from the University of Tennessee, our very own Heath Shuler. Heath, welcome to the webinar. It's great to be here with you again.
Mike, as always, it's great to be a part of the BakerHostetler team and what you've been able with your leadership of our group. It's been quite remarkable, the growth and the opportunity we've obviously bring to the entire company that's throughout the U.S. has been quite remarkable. So congratulations to you and the team. It's been a job well done. Having a series this with the lawmakers makes it we're supposed to have this big event and obviously that being canceled now it gives an opportunity to bring the lawmakers, really maybe even more depth and an opportunity for us to reach out to them during these tough times.
Yeah, that's exactly right. As many of our attendees, listeners know, the BakerHostetler Legislative Seminar, we were scheduled to be hosting that in just a few more weeks in May. And of course, we've had to postpone it until next year, as so many other things have been postponed or changed this year. But it's interesting, as you say, Heath. We on the one hand, that was always a great opportunity to bring people to Washington to meet lawmakers and hear from them, and for us to get to have conversations with them and listen to their thoughts and impressions of what's going on, listen to their plans for what's going on in terms of legislation and public policy. But we've all had to adjust. We're adjusting in our family lives with kids and schools and work, and there's so many adjustments that need to be made. And this is a good adjustment for us. This is a good way for us, I guess, to adjust to this, is to be able to bring our former colleagues, House members, senators, Republicans, and Democrats, bring them to our clients and to our friends around the country. So this is just yet another adjustment, but it's great to be back on the program with you here, my friend.
Thank you, Mike. Having Roy Blunt, Senator Blunt, coming up in a few minutes as far as a person, I'll never forget the very first time I had the opportunity to meet Senator Blunt, and he and Steny Hoyer are obviously very close friends and work together in a bipartisan way during their leadership days. The very first thing that Steny Hoyer told me about Senator Blunt was, you can always believe what he says. He's a trustworthy man. And that went a long way, especially in days in Washington where you really don't know who you can trust and who you can believe. When you have a friend such as I do with Steny Hoyer, to say that about another member, obviously sometimes it gets bipartisan or gets very partisan, and to say that about Roy Blunt, it told me a lot about who he is as a person, and I found every bit of that to be the truth.
Yeah, I
So
think
I'm
that's
really
right.
excited about having him on. He's a great man.
Yeah. Yeah, he's a great way to kick off our webinar series. In case you're just joining us, welcome to our bipartisan webinar series, BakerHostetler, bringing Congress to you. I'm former Congressman Mike Ferguson. I'm the leader of our federal policy team here at BakerHostetler. I'm here with my colleague at the firm and former Democratic Congressman Heath Shuler from North Carolina. So we'll be joined in a few minutes by our guest, Senator Roy Blunt. You can submit questions on this webinar. You can submit those questions that Heath and I can ask Senator Blunt. Please submit your questions on the control panel on the right of your screen on the webinar here. And I'll give you a heads up. This is the first in our series. Our next bipartisan webinar will be here at 1 o'clock next Monday, April 6th at 1 o'clock Eastern Time. We'll be joined by Democratic Congresswoman Stephanie Murphy from Florida. She's a great member of the House, really thoughtful, impressive Congresswoman from the state of Florida, and she's been a guest previously at our legislative seminar, and she's really impressed a lot of folks. So we're looking forward to having her join us next Monday, April 6th at 1 o'clock. So before we're joined by Senator Blunt, let me cover a couple of things. First, we've invited BakerHostetler clients and friends of the firm to join us on this webinar. And as of right now, we have hundreds of people logged in, which is great. Thank you for joining us. Our federal policy team provides government affairs, consulting, and lobbying services to clients that range from Fortune 15 businesses all the way down to startup entities. Our team is bipartisan, features senior staff from both sides of the aisle that previously worked in the House and the Senate, also in the executive branch. We're active up on the Hill every day during normal operations. We're talking with key lawmakers and committee staff, personal office staff. We're at the White House and in key departments and agencies. We're providing our clients with over-the-horizon insights into key policy developments, as well as advocating to shape policy and regulatory outcomes. Second, Heath. So that was the first item, little public service announcement. Second, though, Heath, let's do a quick overview of the CARES Act. We're getting a lot of questions about this. Congress passed it. The president signed it into law. And we really need to make sure that everybody has an overview of what Congress did last week in response to the pandemic. It's a really massive government response for businesses. The major provisions of the CARES Act include more than $500 billion in loans and loan guarantees and direct aid to passenger air carriers, to cargo air carriers, to companies critical to national security, large and mid-sized businesses. There's also specific aid to small businesses, including forgivable loans to help small businesses to keep their workforces intact. There's also a whole series of tax provisions, including allowing employers to defer payroll taxes. Those are taxes that cover Social Security and Medicare, of course, as well as tax credits designed to help companies maintain their employees on the payroll during this very, very difficult economic period.
Yeah, Mike, when you have a massive bill like this, there's obviously trying to get money to the individuals. And with Congress and the White House, when they agreed to, some $1,200 per individual, another $500 per child, that's a substantial amount of money. And if you're looking at the overall, families that earning $150,000 or less, they're going to get $2,400 in a rebate check plus $500 per child, and an individual making below $75,000 a year will receive $1,200. That's a lot, and probably the one that everybody talks about that amount of money, but the one I think that probably may have the biggest impact is when workers are furloughed. That Congress, they boosted the unemployment benefits, adding $600,000 per week, and that's on top of the unemployment benefits from the states. So that's a substantial amount. If you look at that, just the added bonus that the federal government, that's about on a 40-hour work week, that's $15 an hour. So that's a substantial amount of money that is going on top of it. I think there's some difficulties and some challenges based upon how the state system works along with the government system and how those checks are going to be processed. So I think it's going to take some time, and it's going to take some adjusting from the states and the feds how to get that money out. I know North Carolina has already sent out their checks 2 days ago, the first batch of checks that went out. So a lot of states are actually making some quick progress, and there will be some challenges ahead trying to get the SBA loans like you talked about. I talked to our local regional director here, and there was 3 people that worked in the office, and he said it's almost impossible within the first hour of the bill passing. They had 68 phone calls and some over 100 more messages that actually were that were placed in the inbox. And
amazing.
So getting some of so there's going to be some challenges to be able to get some of this money and relief out for people who are in need.
So that's a great summary, Heath, and it's a great pleasure now for us to introduce. I'm going to introduce our guest today. Senator Roy Blunt was first elected to the Senate in 2010. He's currently the Republican in the Republican leadership. He's the Policy Committee Chairman. He's on a number of key committees. Perhaps most important for today's discussion is Senator Blunt is the chairman of the subcommittee that approves funding for the Department of Health and Human Services, the National Institutes of Health, the Centers for Disease Control and Prevention. Essentially, any federal dollar spent on healthcare has Senator Blunt's fingerprints on it. Before he was in the Senate, he served for 14 years in the House. That's when Heath and I got to know him so well. When I was first elected to Congress back in 2000, he was my boss. He was the chief deputy whip. I was one of his deputies, trying to help count votes in what was a very narrowly divided House at the time. And we're very, very pleased, as we've said earlier, that our very good friend and a great leader in our country, Senator Roy Blunt, is our first guest in our webinar series here. Roy, it's Mike Ferguson and Heath Shuler here. Welcome to BakerHostetler's webinar.
Well, Mike, great to be with both you and Heath. And I think last year the three of us did at least part of the fly-in. And I was just on a call with Tony Fauci, Dr. Fauci, earlier today, and the question of air travel came up. And his view of air travel was nobody should be doing any air travel that wasn't absolutely essential. So the decision not to have people fly in for the fly-in would be one that Dr. Fauci at least was in total agreement with. I'm sure when that message goes out, that's not a good message for our airline friends, who are one of the group of people that we try to figure out how to help in a substantial way in this third finance package for looking at the Corona-19 challenge we face. And really, as you see the challenge, as you and Heath and I and others look at that, this is a two-front war. One is fighting the virus, and the other is what we can do to stabilize our economy. And none of the numbers are good. The unemployment numbers that came out this morning exceeded everybody's estimate, I think, at 6.6 million new people asking for unemployment last week, on top of 3 million new people entering the unemployment rolls the week before. And then the numbers that we see the experts talking about is they're talking about the virus itself, where 100,000 Americans dying of Corona-19 would be at the low end of the numbers we're talking about. And so clearly the Congress did come together in the most expensive spending package ever, and 96-0 in the Senate, not even a roll call vote in the House, but we had a roll call vote in the Senate, and occasionally things pass by unanimously in the Senate, but they seldom pass unanimously if the members actually are asked to vote on them one at a time. And every Democrat and every Republican that was there said, even though this is a huge bill and we know it's not perfect and we know we're going to find out in the next few days what we left out. We think we have to deal with this and deal with it quickly, and everything from the direct payments you all were just talking about, the small business loans, I think you mentioned, as well as the impact on critical industries like travel and aviation are particularly impacted by this. And then the part of the bill that I was probably the most involved in putting together would be, as you said, Mike, the healthcare part of this bill, $100 billion, largely focused on hospitals, and not only focused on helping them meet their new expenses that they may have because of coronavirus, but also to make up for some of the lost income that hospitals have experienced in February, March, and now April, from being asked really to stand down from the elective surgeries that they would normally be doing, the elective procedures they'd normally be doing. One reason for that was to make it possible to think about repositioning individual hospitals as you might need to get ready for the unique needs of this crisis. But even a bigger reason, sadly, was just the fact that we have what we anticipate will continue to be a shortage of the personal protective equipment that healthcare providers need. The first healthcare provider died this week as a result of coronavirus, getting it as a healthcare provider. And clearly, we've got to be sure that we're out there at the front lines with those healthcare providers, being sure they have everything they need. Before I move away from hospitals, let me say I had a long discussion last night with Alex Azar, the Secretary of Health and Human Services. We put in the bill the importance of getting this money to hospitals early, and I think they intend to get the first 35 or 50 billion of those hospital dollars out to virtually every Medicare and Medicaid hospital in America in the next 3 weeks or so. So that $50 billion, let's say 50, it might be somewhere between 35 and 50, will go to every hospital pretty quickly. And after that, another 25 or 30 billion will go almost as quickly to the critical needs hospitals, the safety net hospitals, the rural hospitals that are really struggling without the income they would normally have to continue to be open. And so that $100 billion should make a big difference. It's what the National Hospital Group said they'd like to have in the bill, $100 billion. It's what we put in the bill. And so that the critical industries piece, the small business piece, and the direct payments are the things that principally the Congress came together to do a week ago. And again, this is at $2.2 trillion. This is the biggest spending bill Congress has ever voted for. And I think we did it knowing that we had to step in and fight both fronts of this two-front war at the same time.
Roy, that's a great summary. Thank you. And Heath and I are both going to have a couple of questions as we go along here. But let me just kick it off. You've mentioned conversations with Secretary Azar, conversation with Dr. Fauci. I mean, you know, as the chairman of the Appropriations Subcommittee dealing with all of these health agencies in our government, you are obviously very, very important to them. And I know that our, agencies of governments tend to stay in touch with those appropriating the dollars for them, because it's very, very important to keep those members educated about what's going on. So you are in some ways uniquely accessible and have access to these key healthcare leaders in the government right now. How you've summarized a little bit of some of those conversations. How are they doing? How do you feel like the CARES Act, that major legislation, is it having the impact with our healthcare agencies that we hoped, that you hoped, and are there ways that are things that have come up that have been maybe unexpected so far in terms of equipping them to deal with first the health challenge that we're dealing with as a country?
Well, one of the things I'm most pleased about so far is that the HHS, the Health and Human Services Secretary, and his team appear to be taking very seriously specific things we put in the bill. I had a long call with the Missouri Hospital Association, about 50 or 60 different healthcare providers represented in that call the week we were putting this bill together. And the most critical thing to them was to keep that flow of money starting as soon as we could get it started. You know, hospitals are very much like lots of businesses or lots of charities or lots of groups. Hospitals are very much a money in the door and money out the door operation. They have a little cushion, but the smaller the hospital, the smaller the cushion, or the more critical access the hospital, the smaller the cushion. Seeing this money go out and seeing it go out without, there'll be some, I think the application process will be minimal to people that have had an experience as a Medicare, Medicaid provider. The Center for Medicare and Medicaid Services, CMS, knows all of that. They have all of that. They know everything that happened to those providers and with those providers in 2016. And they're going to respond, first of all, based on that knowledge and get that out. And then looking at the needs of the critical access needs, we put $16 billion in for more personal protective equipment. I think there's a real effort being made to assemble that equipment. A lot of volunteer groups have stepped in. I saw where the New England Patriots, Kansas City Chiefs may not have an airplane now. That may be why they didn't go over yet, but they flew an airplane over, brought it back with face masks and other things for Boston area, Massachusetts area hospitals. I think a lot of that is happening. And we also continue to provide more and more money for research, both for therapeutics and for a vaccine. And Johnson & Johnson announced just this week that they plan to go quickly now. They're ready to go to human trials with a vaccine. It's possible that early next year a vaccine could be available. It's more than possible that by the fall of this year and even the summer of this year, we'll know much more about some therapeutics that will have been proven to make a difference with people. So I think the healthcare side is we're doing about all we can. Social distancing does matter. Understanding just the normal basics of how you treat this virus to some extent, even though no person has ever had this virus, we believe, before this year, which makes it much more difficult to manage and analyze and get under control. It's a fairly weak virus to kill, in that if you're careful about what you do with your hands and your face, if you keep your hands clean, if you're thoughtful about the surfaces you touch, certainly if you're staying at home by yourself or with your immediate family, this is a fairly easy virus to put off. And the longer we put it off, the better we'll be prepared to deal with it, which is why the president's made some of the decisions he's made, and some of our governors have, and many local officials, about the requirement for people to stay away from their normal activities, but at the same time to keep those essential jobs like police and fire and food production and medical production and to keep those essential jobs going. And I think we're more and more aware of ways to test for people and to do that.
Senator, hi, this is Heath Shuler. Thanks so much for being a part of the program again. It's always a treat to have you a part of the BakerHostetler seminar. And I was telling the BakerHostetler family that my first time I had a chance to meet you was with Steny Hoyer. And as you walked away, Steny Hoyer looked at me and he said, Heath, you can always trust that man. He's a man of his word, of great character and integrity. And I found that to be the case the whole time, Dylan, when even though we're on opposite sides of the aisle, you are a man of integrity, and I greatly appreciate your service and you being a part of this every year, how as you have been for many years.
Well, I appreciate that. Steny and I were the Republican whip and the Democrat whip together for several years, and he's one of my closest friends. And it means a lot to me that he would have that evaluation of me to you, and I certainly have that same sense of him. And glad to be with you today, just like I always have been in our time serving together in the Congress and in your work since then.
Well, thank you. I have a kind of two questions. One would be, the question is an infrastructure bill. That's kind of been talked about by the president. Even Pelosi's talked about it from the sense of, wants to act now. If you take another $1 trillion on top of that, plus the 2.2 that we spend, and maybe another some money, being a blue dog, are we going to do the infrastructure bill? But, having that blue dog in my past, debt and deficit, something that Mike and I talked about yesterday for a long time. How do we ultimately pay for this?
Well, I do think it's important that we keep the economy going and at this point, keep it as stable as we can. The difference in this and like the 2008 and 2009 situation that we all three dealt with was a big economic problem, but
yes,
the economy didn't just shut down like the economy has right now. And there was some systemic problems with the economy in 2008 and 9. In April of 2020, we're 60 days away from maybe the strongest economy in decades. And one of our goals here is to try to stabilize that economy and have come out of this with as much of that economic engine running as we can continue to maintain, even though it may be maintained on some level of idle right now. But we want that engine to be started up. That's one of the reasons, Mike and Heath, that the Paycheck Protection Program here is so unique. It was designed to encourage businesses, small businesses with 500 or fewer employees, to keep people on their payroll. Those are loans that can be forgiven, but we thought, and I still think, and I think most members still think, that keeping people on your payroll, they still have many of the benefits of employment, health care, and other benefits of employment. They don't have to be hired back when the engine is ready to rev up again. And keeping people on your payroll, very important. These are forgivable loans. They're 1% loans, I think, if not forgiven for whatever reason. They were yesterday discussed as half of 1%, but the Secretary of Treasury, I was on a call with him and other senators today, and he said he had just announced it's a 1% loan, which gives the banks some of the working room that they need. This is largely forgiven. The whole idea to keep people at work, and then on your bigger question that all three of us would have concerns about, how you pay this back, how can you possibly spend $2.2 trillion, at least half of which is not going to come back. But the other thing is, what's the long-term cost if we let the economy needlessly get jeopardized beyond where it has to be? And I think the decision we've made so far is this is money that needs to be spent. We need to keep this economy in place. How much we can put on top of that, I don't know. I do know that I'm not for using the coronavirus challenge as an excuse for either side to do things that they have individually wanted to do politically for a long time and get into I'm not going to vote for the bill, or I'm not going to sign the bill unless it has this non-coronavirus package with it. Would be a big mistake. I don't think we're going to let that happen. Infrastructure, critical part of the federal responsibility and the state and local responsibility. We hope that every 6 months since the president was inaugurated, that there'd be a bipartisan coming together on infrastructure. One bill, the Senate bill, is like $287 billion. The House bill is $1 trillion. And clearly one of those is more affordable than the other. But I'm sure you could argue that we could easily do $1 trillion worth of infrastructure in our country that would be beneficial to the economy in the long run. But at some point, we do have to think about what obligation do we have to keep our government debt at a level that it doesn't jeopardize the future.
Roy, this is Mike. We're getting a number of questions about supply chain, and I know it's on a lot of people's minds. It's maybe something that's becoming more obvious to people who don't think about it very much, but of course, so many of our industries, including our medical supplies and pharmaceutical and biotech industries, have supply chains that are, all over the world. This crisis is highlighting the challenges of that system in many ways. You have Peter Navarro at the White House and even some of your Senate colleagues I know who are real hawks on, sourcing from China, sourcing from India, especially when it comes to, active pharmaceutical ingredients, for instance. How is this playing out? How do you see this playing out in the current crisis? And maybe once we're on the other side of this crisis, God willing, it'll be soon. How does this policy issue develop in a post-crisis world?
Well, we did put in the bill itself a bill that Senator Durbin from Illinois, a Democrat from Illinois, and I had worked on, Senator Alexander from Tennessee, Senator Murray from Washington State, who chair the authorizing committee, who co-chair the authorizing committee, joined us. So the four of us produced a piece of legislation asking the National Science Foundation to quickly look not at supply chain writ large, but at supply chain as it relates to healthcare. And so we would hope within a matter of just a few months, they come back with recommendations on that, about more than half of our pharmaceutical ingredients come from overseas, most of them from India and China. Looking at pharmaceuticals, at medical devices, and medical equipment were the three things we asked to look at. And let's talk about this supply chain problem and how critical it is, if we only have one source, that we have a backup, and frankly, how critical it is that we work hard to be sure we always have multiple sources, whether they be Mexico or Canada, our nearest neighbors, or multiple sources on healthcare. And I think, Mike and Heath, I think that not too far down the road, we need to look at supply chain generally. If you're making something and you get 300 component parts in an electrical thing, your technical thing you're putting together, and you've got 299 of them, but your supplier for that 300th part, for whatever reason, has decided they can't or won't sell it to you, you've got a significant problem that affects your entire workforce, as well as all the people that you might be working with in our country to get the other 299 parts. You need to put that together. So I do think there's an interest in looking at supply chain. We saw very early with China, we had both a demand problem in that they weren't buying what they'd been buying before, and a supply problem in that they weren't getting into our supply chain some of the unique things that we had learned to rely on China for. And of course, as you pointed out, that's one of the things the president has been a big advocate for, looking at how we get more things made in America when it's possible to do that. I think there's a trend to do that anyway, but there should also be a trend to be economically competitive and look for other providers in the big global economy, but probably have a better backup plan than we've had up till now. And I hope the National Science Foundation on the healthcare side is back in just a matter of a few months to tell us what our better backup plan needs to be for pharmaceuticals, medical supplies, and medical devices.
Let me pick up on that, specifically on the pharmaceutical industry. And, there's, you've been a longtime supporter of medical innovation. I grew up in New Jersey. We like to call ourselves the medicine chest of the world. And I've known so many researchers and scientists and folks who are working on cures and treatments, and their work has been put in the spotlight here, of course, too, with vaccines and other treatments and work that they're doing to try to help address this particular crisis. But of course, it wasn't long ago that you have folks who will take to the microphones and the TV cameras saying, pharmaceutical and biotech CEOs are crooks and corrupt and whatnot. As they say, you've been a longtime supporter of medical innovation and research and development, particularly with the way, you see into the funding of our government agencies when it comes to healthcare. Once we get past all of this, how do you think the reputation of the life sciences industry, particularly our biopharmaceutical companies, how do you think they come out of this? Are we going to go back to sort of one side advocating for government price controls and the other side trying to protect medical innovation?
Well, I think it's too early to tell, but I do think it's significant the way the medical innovators in our country have stepped up and tried to reach a new level of testing. Abbott Labs and now others have come out with additional ways to test for coronavirus. Johnson & Johnson's, I mentioned earlier, and others are on the edge of going into human trials with a vaccine already. Now, that doesn't mean every person can get that vaccine, but human trials take some time, but it means we may get a vaccine quicker than we would have ever thought possible before. Others are looking at the ways to use medicine that they have been using for other things and working with FDA to see if there's not a quicker way to verify that this is also a positive addition to the fight against COVID-19. And so I think, frankly, our medical industry, the industry of the suppliers, the medical supplier industry, has a unique opportunity here to step up and once again show why we're able in our country to do things that no other country is able to do in the same way. And there's no question that there's a lot of frustration as Americans look at all of the drugs that have been developed, and that we clearly pay an unfair share of the research and development of those drugs, but it's not like there's anybody else who's willing to pay that share if we no longer lead. And generally, leading has led to a lot of economic activity, as well as a lot of great healthcare advances in immunotherapy and other things that have dramatically changed the way we look at healthcare in just the last 5 or 6 years. But it does appear to me that this is a real opportunity for that community to step up, and they are very much stepping up.
Senator, this is Heath. We're going into an election. We are in an election year. You see over the last few years, it seems like the intensity of more partisan politics and the ads are getting more difficult to watch. Do you think with a crisis like we're in, do you think that there's, and the votes the way it has been in the House and the Senate, that there's more collaboration, more working together and truly putting the American people first before the politics? Do you think that's, a crisis sometimes, can help those relationships and build more cohesiveness within the halls of Congress? Do you think that could happen, or do you think that as soon as this is over with, we go back to business as usual?
Maybe even before this is over with, Heath. I mean, you and I'd both like to see that happen, but that may be just hope over experience, hoping for the right thing to happen instead of understanding how divided the politics of the country, how divisive they have become. Certainly after 9/11, there was a coming together in the country that lasted for a couple of years, and in the Congress it lasted for maybe almost that long, to where there was kind of that was pre 9/11, and now we're in a post 9/11 environment where we're going to work harder to get things done. And the numbers, the polling numbers for Congress, were the highest in 2002 and 3 as I think they've maybe been since World War II. I don't see that quite happening here, and part of it is we're just within months of a presidential election as opposed to 9 months into the term of a newly elected president. We're less than 9 months away now from the end of the first term of that president, and it's hard to imagine that that politics doesn't continue to go down a path that is more divisive than our politics have been in times in the past. But our politics have always been pretty tough in this country, and there have been more placid times, but the last 10 or 15 years seem to get more and more challenging as there are more and more outlets to express one view. And I don't just mean the TV outlets. I mean all of the social media, all the various Facebook pages out there, all of the whatever people are using to express their own opinion, and frankly, to begin to feel stronger about whatever their predisposition was. I'd like to think that we all come together and work hard and minimize the politics, but it's pretty hard to imagine that happens in April of a presidential election year or any month after April of a presidential election year.
Roy, this is Mike. I got one more question for you. You've been very generous with your time. A lot of questions from folks about what comes next. Bill number 4, package number 4, or however it's referred to. I know Congress, I guess, is not going to be, expected to be coming back into session for another few weeks. Seems like your Leader McConnell, wants a bit of a pause. Speaker Pelosi, of course, is going full bore ahead. How does that play out, and what do you expect? You've got quite a perch there in the leadership in the Senate, and Heath and I know what an astute observer you are of what's going on and figuring out when there opportunities are to drive something, and when you need to sit back and let things play out a little bit. What's your crystal ball telling you about the next few weeks and what may be coming up?
Well, part of that will be driven by what we see and whether we see a flattening of the curve here, whether we see this beginning to appear much more manageable, or a level of desperation sets in that hasn't set in yet. But it's a very scary thing to be involved in daily, as most Americans are, to watch, to worry about your family and all of those sorts of things. And that drives this to some extent. My own personal view is that there needs to be a coronavirus number 4, but number 4, if it was up to me, would be very narrow, to try to quickly fill in the gaps that we all knew had to be there somewhere in that big package that was number 3, and then maybe give this some time and decide if there needs to be another dramatically aggressive economic effort made, like the third package did, or where we are exactly on healthcare and our healthcare providing institutions. I would hate to see us decide we're not going to improve on the problems that will clearly be there with package 3 without having all kinds of things held hostage in a bigger fight about what a package should look like maybe by the end of the summer. We need to wait a little bit to decide if there needs to be another direct payment effort made. The thought was on this direct payment, it would probably be a direct payment that would be the only payment like that to almost every American family that makes less than $100,000 on an individual basis is going to get some kind of payment here right away in the next 2 or 3 weeks. And to decide whether we need to do that again, shouldn't be something, in my view, that we decide in April, but something that we decide maybe in more like the June or July time frame. Doesn't mean there doesn't need to be a cleanup effort in April or early May, but it does mean that we shouldn't use the 4 or 5 or 10 or 12 things that clearly are problems that we created with the rush to get the appropriate rush, in my view, to get this third package done. We shouldn't use cleaning those up held hostage by every pipe dream that every politician in Washington, D.C. on both sides of the aisle might have. And so I think we need to put off the next big package, but the next package needs to be a package that just simply responds to what we got wrong in this great and appropriate effort to try to stabilize our economy and fight this virus in a very short time. This is the third package we've done in less than 2 months. And the biggest spending bill in the history of the country. I hear some of my colleagues talking about how the next time we ought to spend even more than that. I think we need a lot more information before we decide we're going to spend this amount of money again in the immediate future.
Well, thank you so much. Senator Roy Blunt, thank you for being on the webinar with Heath Shuler and me today. You have been, I was just counting up the years when we were talking about the post 9/11 world. It's been close to 20 years that I've known you, and I've had a chance to work with you in different capacities. And you are a great public servant and a great friend, and certainly gives me confidence knowing that you're at the table helping to craft legislation, helping our country to respond to this incredible pandemic, this incredible crisis in multifaceted crisis that we're facing. So on behalf of Heath and all of our colleagues at BakerHostetler and everybody on the webinar today, I want to thank you. Heath and I will have some closing comments, but we know you have a lot to do. So we appreciate you being with us. And thanks very much.
Great to be with both of you, and best for you and your families. And everybody needs to do their best to stay safe and help others right now.
Thank you. Thank you, Senator Roy Blunt. So, Heath, you and I have a little bit more work to do. A couple more comments here, but we've got some more work to do on our webinar coming up next week. Do you want to tell our audience a little bit about our next installment? Heath, I don't know if you're there, but maybe you're on mute. But I can.
Yes,
tell,
I was on mute. Sorry.
There you go.
Yeah, Stephanie Murphy will be on April the 6th. That's Monday at 1 p.m. An incredible member of Congress that's really making a huge impact in the Democratic Party. A Blue Dog member, so more of a moderate member from the Orlando area of Florida. Very bright. Has done a fabulous job and really making a name for herself in the leadership role that she's taken both with the Blue Dogs and the Democratic Party, trying to push more of the policy back toward the middle as she's done so many times. And oftentimes we don't see it, but it's the work behind the scenes that she's done so well.
And she's a member of the Ways and Means Committee, very important tax writing committee. They deal with healthcare issues. They deal with tax issues. It's a really important committee, and she's a great voice. She's been a guest at our legislative seminar, and we're looking forward to having her back as a guest on our bipartisan webinar series, BakerHostetler Bringing Congress to You. So Congress is out of town, out of session for the next few weeks, but we are continuing with the webinars to bring members of Congress to you. And, Heath, I think it's valuable when our firm's clients and friends, when they get to hear directly from our former colleagues, folks serving in office on the Hill.
Yeah, it's really great. I mean, even as often as you and I get to speak to them, whether it be on the business side or the personal side, even times like this with Senator Blunt and others that we'll have on as we go forward, I know you and I learn something every day. I mean, there's something that we learn from those members. There's some new insights that we can help our clients. And and to be able to relay that information that can better help them in the future, especially during a crisis like this. So it's always great to have these members, and I greatly appreciate your leadership and the entire government affairs team, what's been able to put something like this together to bring all of our colleagues throughout the Baker-Hostetler family together.
Well, likewise, Heath. So please join us next Monday, April 6th, 1 o'clock Eastern, for the next installment of our bipartisan webinar series, Bringing Congress to You. Make sure you register for that webinar and for future webinars on our website, bakerlaw.com. That's bakerlaw.com. And Heath, until next Monday afternoon, be safe, and very best to you and your family.
You as well.